What special help might I need after surgery? If you've had surgery for either a type A or type B dissection, you may need special help, which your medical staff will recognize and provide. These issues are less likely in medically managed type B dissection cases. Not everyone will experience these problems, but the following types of help are common for some aortic dissection patients. Help to breathe. Once the breathing tube is out, you will be given an incentive spirometer, which creates resistance when you breathe in. This is a workout to strengthen your breathing muscles and should be used 10 to 15 times every hour when awake and then taken to rehab or home to be used frequently. Chest drainage tubes. If you have had surgery, it is common for chest drain tubes to be placed. These allow any buildup of fluids inside your chest cavity in the days after your surgery to be monitored and drained. The chest drains will be removed at the right time once your medical staff are satisfied it is safe to do so. Nutrition and blood tests. Your blood will be regularly tested and checked for the necessary components and to ensure everything in your body is working correctly, especially your kidneys. You can expect regular blood samples to be taken probably every day at first. The hospital should give you appropriate meal selections and may also give you supplements to help you recover. Feeding. If you spent over a week in ICU, it is possible that you will have been given your nutrition through a feeding tube inserted into your stomach via your nose. This will be removed once you are able to swallow safely and eat enough calories. At this stage, you may find the taste of normal food unappealing, but your normal sense of taste will return in time. Speech. Some surgical procedures, including the use of a tracheostomy tube used for severe breathing or lung difficulties, may affect your ability to speak. If you are not ventilator dependent and still have a tracheostomy, you can be provided a valve that is placed over the tracheostomy to allow you to speak. Your medical staff will observe how well you are able to talk and help you understand and manage your situation. Speech difficulties are usually temporary and resolve in a few days or weeks, but sometimes voice difficulties persist after you are out of the hospital. See page 54. Help with going to the toilet. In the first few days, you may have a urinary catheter to measure how much urine you are passing. It will be removed a few days after surgery once the medical staff are satisfied that your kidneys are working well and you are passing enough urine. If you are unable to get out of bed once the catheter has been removed, you will get help with going to the bathroom. This will be necessary only until you can manage by yourself. Your bowels may be slow to return due to the medication, which slows them down in addition to not eating much. Medicine to move your bowels will be given to you daily. Do not strain. They will return to normal over time. Be patient. Strange dreams and fears. A side effect of anesthesia, surgery, and some medications is that you get strange dreams, hallucinations, or nightmares. They may feel very real. This is normal and is due to the procedures and medications, not your own state of mind. You might also become fearful of what has happened to you and how you are being looked after. You may even be worried about what people are doing to you and whether you are getting the right treatment. Some of these things will be noticeable by your family. Such experiences are often called ICU delirium. This is a recognized side effect of the trauma you've been through and the medications you need to help you recover. These experiences will eventually decrease and disappear as you recover, and the medications are reduced and eventually stopped. You and your family can rest assured that this is normal, that your dreams and hallucinations are not real, and that you are, in fact, being treated properly and professionally by the medical staff. Heart rhythm disturbances, arrhythmia. Especially after major cardiothoracic surgery, your heart may not beat normally and regularly. Around one-third of patients who have surgery for aortic dissection develop atrial fibrillation, where the heart beats irregularly and sometimes very fast, tachycardia. This can feel strange and disconcerting. It's often treated with medications to help the heart go back to normal rhythm and to minimize the risk of stroke. Sometimes the irregular heart rhythm may persist when you get home, and you will need to continue taking medication for it until your heart goes back to its normal rhythm. Stroke. Sometimes patients who have had an aortic dissection will also experience a stroke, either when their dissection happens, during surgery, or afterwards. A stroke can lead to difficulties with speech or movement. If you have had a stroke, you will be specially monitored for its effects and referred to a stroke specialist or stroke unit to help you get over the effects. For more information, see the section on complications on page 53. Spinal cord injury. Aortic dissection and surgery can sometimes affect your spinal cord and cause a partial or total loss of ability to move your legs. Depending on the cause, this may be temporary or permanent and may require special treatments. Your medical team will assess you for any spinal cord injury and will ensure that you get the right specialist help if you are affected. If you are worried at all by any of the things described on pages 28 through 30, let a nurse know and they will ensure that you get the right help and information. This image is of a medical professional assisting a patient.